Okay, students, so focus of discussion here is ethical principles. So when I say ethical principles, take note that when I say principles, your principles is equal to the word that it acts as a guide. Now, when I say ethical principles, these are ethical guides. Now, if you can notice, I would go back again to the word law. Take note that these ethical principles are not laws, which means that when you will be asked if the ethical principle is applicable in all setting, is it? When I say ethical principle, is it applicable in all settings or not? Sige na, kahit satat
No,
lang.
sir.
No,
Okay.
sir.
So plus, these are not laws. These are only guide. So I will be able to refresh your memory on some of the ethical principles, but then you need to remember that it will be case-to-case basis when you are dealing with your patient. Now, our focus for today is their autonomy. So we've talked about autonomy since maybe day one of our discussion in ethics. For us to know where autonomy came from, it came from the word autos, meaning self, then nomos, which means rule, govern, or law. So if you would combine it, it would mean self-rule, self-governance, or self-law. In other words, class, freedom from external control, which means that if I am dealing with my patient is not coerced. The usual words there that you will encounter is coercion. Okay, so meaning your patient is not coerced, your patient is not forced, or your patient is not influenced by any other factors. That's what we refer to as autonomy. Okay? Now, let's picture an example of a patient. Now, let's picture an example of a patient who has been alcohol intoxicated. When I say class alcohol intoxicated, meaning grabe talaga yung pag-inom ng alcohol, parang nag-break up ng 3 times in 3 days. Parang mga ganong drama, no? 3 times in 3 days. Tapos, a lot of alcohol was taken. Now, this patient with alcohol intoxication, for example, came into your hospital. And then when the doctor said that we need to insert an intravenous line, the patient refused. The patient refused. Now, given the case that the patient is intoxicated with alcohol, do you think the patient has autonomy to decide on the matter? Do you think there is autonomy for the patient to decide on the matter? I want to see
No,
your
sir.
answers even in chat. Sige, how about others? Even in chat lang. Pakita niyo yung sagot niyo sa chat para I will be able to know what are your insights. Intoxicated ang pasyente pagkatapos ayaw niya ng treatment. So that's the patient. Is the patient in the position to make use of the principle of autonomy? So class, as of this time, it's not, because you know that your patient is under the influence of alcohol. Meaning students, your patient does not have full autonomy. No? Yeah, because the patient is under the influence of. So class, when I say autonomy, it is the freedom from external control. So if somebody is pointing a gun at you, that is not autonomy. Okay? A simple example in research is this, no? For example, if Brian is a patient in our clinic, no? Wellness check-up ni Brian. Then I told Brian, hey Brian, we have a new research that we are conducting about this drug. Then Brian said, sir, parang alanganin ako mag-join. Brian, if you will not be joining this, you won't get a grade in your ethics class. Okay? From there and then, you would know that the principle that I encompass, or the principle that I cut, the principle that I did not follow, is autonomy. In other words, I'm trying to coerce Brian. I'm trying to use my influence as a teacher to tell Brian what to do right. Okay? Now, in the past, no, if you've heard of issues about sexual abuse also, which were conducted by few teachers, so there are instances wherein teachers would say that if you would do this, your grades will be passed. No, your grades will pass. So, ladies and gentlemen, even if that would happen to you, please do not tolerate that. Please do not tolerate that. Take note that if these opportunities if you would give the opportunity for others to do it to you, it won't happen only for the first time. It will be continuous. It will be continuous. So, sir, anong gagawin? For example, si Brian sa situation na binigay ko. Brian is my student. And then I am convincing Brian na Brian, mag-participate ka sa research. If hindi ka mag-participate, failed ka sa ethics. So what would Brian do? Brian could actually tell me, sir, I'm so sorry, I cannot, sir. I don't want to participate in this research. If I will insist, Brian could also still insist, sir, with all due respect, I need to talk to my mother about this. And then guys, if you are in that situation, the best thing that you can do is get out already. So for example, if Brian and I is talking face to face, so Brian can slowly already take the exit, no? Before I would say other words that Brian could not anymore handle. Okay? Because class, if the person is so persistent that he would want to do something against your will, he might take moves, no? I might take moves that is against the will of Brian. So para maiwasan mo nang malagay sa sitwasyon na hindi mo kayang i-handle, try mo nang mag-get out. Okay? But as you can notice, Brian, I'm not advising na to shout against me. It's not advised to punch me because after all, those are not the ethical things also for you to do. Okay? So best for you to get out of the situation. Now, that is if your autonomy will be impaired. Now, going back to the definition of autonomy, we have a lot of autonomy here. One that we are talking always is the autonomy of the patient. In other words, our patient has the right to self-determination. Now, our patient has the right to self-determination. Other than that, guys, there is also autonomy of healthcare providers. Huh? When I say here, class, autonomy of healthcare providers, we also have the autonomy, especially of our physicians. What do we mean by that autonomy? The physicians class have been trained to handle the patients. They have their own respective ways as to how to manage the patient. And they have an autonomy on how to do that. Okay? That's why as nurses, it is not practical, no? It is not practical for us to say na, ay sir, alam mo, mali yung ginagawa ni Doc. Uy, ay sir, alam mo, hindi mo dapat tularan ang ginagawa ni Doc. No, that is not how we deal with it as nurses. Because take note, there is also autonomy of the healthcare providers. Okay? Now, other autonomy there that would be extended is that their autonomy to decide when to visit their patient. Now, if you can notice, now if you have been patients in the hospital, you don't know when the doctors will be emerging from their clinics, no? And you don't know when the doctors will be visiting you. That's part of their autonomy, my dear students. Then, other than the autonomy, we respect also the autonomy of others. So it's not possible for me to say, I am a patient. I have the right to decide. So I decided to punch my nurse. Hindi pwedeng ganon, no? Hindi pwedeng ganon. So the usual dictum that we have is that your freedom, okay, your freedom begins within you until the tip of your nose, and it ends by the tip of my nose also. Okay, so which means that by the time that you cross my border, it is not already your rights that you are talking about, but it's already my rights. Huh? Then other than that, your patient has the right to accept or refuse any treatment. Okay, so for example, the doctor is suggesting, hey patient, you need to take this antibiotic. And then the patient will say, no, I refuse. Can the patient refuse the antibiotics, guys? Can the patient refuse the antibiotics? What do you think? Pwede bang i-refuse ng patient yung antibiotics na binigay ni doc? Students? Sige na, you answer. Okay? So class take note, no? Even commonly, no? Commonly in our culture, we use the term doctor's order. Diba? Doctor's order. So if you would look at the chart, there's a form they referred to as the physician's order or the doctor's order. Now class, not because it is an order, hindi na pwedeng i-refuse ni patient. Okay? So as I have mentioned, your patient has the right to refuse any treatment. But before you document that the patient refused the treatment, what would you do as a nurse first? Example, Dr. Porke told Nurse Christine, we need to start this antibiotic. I've already talked to the patient. When Christine visited the patient said, I refuse to take the medication. What's the best thing that Christine would do? Sige na, ideas. Nag-refuse si pasyente ng order ni doc. What's the best thing that you would do as a nurse? As a nurse. Sige, I'm listening. Okay, ask what is the reason. Very good, you asked for the reason. And then after that, okay, Inform the doctor. Yes, very good. Okay? If you can notice, I did not capture the word document because we do not just document it yet. No? So, instead, okay, tama, ask what is the reason. Huwag mo nang mag-document. Then, inform the doctor. Tama din ang explain, sir, kung anong purpose ng gamot. And then say the risk and benefits of the medication. Yes, those are the things that you can do. Okay? So, guys, if somebody would refuse, step 1, assess. So, when you assess, ask further. Ano pong reason? Okay? Baka sabihin niya sa'yo, oy, belief kasi namin, wag mag-take ng mga antibiotics. So, at least you can be able to intervene. And then after that class, you educate. You need to educate your patient. For example, as nurse, you've known pharmacology. So you can tell the patient, ma'am, according to the doctor, according to the assessment, you have an infection. And it is the antibiotic that would be able to help you, as explained to you by the doctor minutes ago. Pagkatapos, pag ayaw niya pa rin, educate mo siya. Tulad ng sabi ni Kirstine, educate niyo siya what are the risks and the benefits of her decision. Okay? Pag ayaw niya pa rin, inform the doctor. And you can only document that the patient refused the care by the time that the doctor has already talked to her. Okay? Now, as I have mentioned also last time, what's the important thing that you need to document, guys? Okay? Di ba magdo-document ka, patient refused? You also need to document, my dear students, the level of consciousness of your patient along with their level of alertness and orientation. Okay? These are your responsibilities as a nurse. Bakit ko kailangan i-document ang level of consciousness, alertness, and orientation of the patient? It will give us a hint that the patient made an informed decision. The patient made an informed decision. In other words, guys, the patient is in his right mind. The patient in his right thinking when he said that he will not take the medications anymore. Okay? So, sir, anong dinodocument sa level of consciousness? Nilalagay mo dyan, patient is awake, patient is GCS 15. If you can recall health assessment, guys, GCS is the measure for the level of consciousness. And then you can say that the patient is alert and oriented. Okay? So class, paano nyo assess ang orientation? You ask the patient what time of the day it is. Where is she right now? Who is this person beside him? And what is the reason why is he or her in the hospital? You ask those 4 things. Okay? So for example, right now it's about 11 a.m. When you ask the patient said, you ask the patient, sir, what time is it? Then the patient said it's 11 p.m. Whereas the windows are open, everything is open. So meaning, guys, if that patient would refuse treatment, you know that that patient is actually not in the right state of mind. Okay, so meaning you need to consult the significant others before the treatment can be documented as refused. Okay, so that's why mag-document kayo, so ilagay nyo dyan. Patient is awake, alert, and oriented. Patient is able to describe the place, time, person, purpose, and the patient decided to refuse taking the medications. The physician was able to talk to the patient, but then the patient is final with her decision. Okay? That way, guys, we were able to establish na he is in the right state of mind before he refused. Why? In the courts of law, no? For example, no, in the courts of law, nagkasuhan, namatay yung pasyente. Pagkatapos yung family hindi matanggap. Okay? Tapos yung kinamatay pala ng pasyente kasi hindi siya nag-take ng drugs. So by the time that the court would open the chart, they would look at it. Was the patient able to make the right decision for herself? Okay? If it was not documented properly, class, who will be held liable? The hospital, the doctor, and the nurse. The hospital, the doctor, and the nurse. Don't worry, hindi ka mag-iisa doon sa may hindi ka mag-iisa doon sa mga rehas, hindi ka mag-iisa doon sa mga kulungan, no? May kasama ka naman kahit pa paano. Okay? But kidding aside, students, no, it does not really mean that by the time that you will by the time that there is a case, you will be imprisoned right away. You need to undergo process. May process naman tayo bago ka makulong. Okay? Now, there is the right to self-determination, as what we talked about earlier. Yes, is there a question from the group? Okay. Now, if you would look at patient autonomy, it is the right of the patient to make decisions about their medical care without the healthcare provider trying to influence the situation. For example, class, if you're dealing with a specific disease, and then there is option A, option B, okay, and then option C is no treatment at all. Option A, class, let's say, for example, that's the treatment available in the market. Option B, class, is the experiment which is being conducted by the doctor right now. Example lang ha, itong doctor, no, right now, nagko-conduct ng experiment. So, class, hindi ba pwede that when the doctor is talking to the patient, it's not possible that the doctor will just talk about the good parts of letter B, the good parts of letter B, and the good parts of letter B. Okay? So, hindi pa pwede, no? Halimbawa, sir, ako pala si Dr. Blah Blah. I am conducting a research right now. You know what? Ang galing ng gamot namin. Halos lahat ng tumor nakuha niya. Halos lahat ng mga ganito, ganyan, sir, ang gagaling. Hindi pwede yun, guys. Because that would appear as if the healthcare provider is influencing the decision. Or let's say, for example, the doctor would say, or for example, the patient refused treatment. Okay? For example, patient refused the drug he is experimenting on. And then the doctor said, lumipat ka na lang sa ibang doktor kung ayaw mong maniwala sa akin. That very line, class, no? That very line tells us that the doctor is trying to influence the decision of the patient. And that's not how it should be. That's not how it should be. Okay, so that's how important your autonomy is. So class, take note that autonomy allows healthcare providers to educate the patient, but it does not allow the healthcare providers to decide for the patient. As I mentioned earlier, you can give the healthcare, the physician can give options A, B, C for the patient, but the physician could not decide that the patient will go to option B. Okay? Hindi pwede na yung physician mag-decide ng ganyan. Then other than that, guys, you shall not treat a patient without the informed consent. Okay? And take note when I say informed consent, when I use the term informed consent, that would mean, class, that the patient made an informed decision. In other words, class, the patient knows all the risks and the benefits before he made that decision. Okay? When I say informed consent, don't just think of informed consent as one form that you will accomplish and just one form that the patient will sign. So hindi siya ganon. Plus, when I say informed consent, your patient should be able to make the decision because they know all the facts related to that condition, related to that treatment. That's what you meant by an informed decision. Okay? So, class, hindi pwede, no, na i-treat ang pasyente without the informed consent of the patient or their lawful surrogate except in narrowly defined emergencies. Take note, may except narrowly defined emergencies. Bigyan ko kayo ng example. For example, picture a patient, 30-year-old male. He came in the hospital with severe bleeding. Okay? Severe bleeding siya, guys. Tapos the patient is unconscious. Diba, when I say unconscious, the patient could not be talked to, we could not discuss to the patient, no? Hindi natin siya makausap. What would you do as a nurse? Manage the patient or wait for consent? What would you do as a nurse?
Manage the patient.
Okay, very good. Okay, so you need to manage the patient. Okay? Sir, sabi dito, you shall not treat a patient without the informed consent. Paano yan? Bleeding siya, unconscious siya. Sinong magbibigay ng consent? Guys, that consent is what we refer to as your implied consent. That consent is what we refer to as your implied consent. Okay? In other words, pumasok siya sa hospital, dinala siya ng pulis sa hospital, dinala siya ng 911, dinala siya ng emergency responders sa hospital, that patient needs to be managed. Okay? Halimbawa, sir, paano kung kailangan niyo ng operation? Kasi class, in surgery, you really need to have the consent. Class, for the operation, no? So ano pong ginagawa namin yan sa ER? We will call the barangay where it happened. And then class, we will ask the barangay officials to look for the significant others of this person. Okay? Kung kakilala nila, hanapin nila, dalhin nila si mother, dalhin nila yung asawa, dalhin nila yung anak doon sa hospital so that somebody will be able to decide. Isa pa, paano pag wala? How about if wala? Who can give the consent? Plus, the medical director of the hospital can give the consent. Okay, the medical director of the hospital can give the consent. So, class, medical director is usually among the highest administrative officials in the hospital. Okay? Basta class ang premise, no? For example, surgeon, may surgeon. Ang surgeon natin, class, si Doc A. Okay lang din ba, class, na si Doc A din ang mag-sign ng consent in behalf of the patient? Okay lang ba na si Doc A din ang mag-sign class ng consent in behalf of the patient? Pwedeng ganon? Hindi. Okay? Tama si Sarah, hindi po siya pwede. Okay? So class, that's why I have mentioned that it will be the medical director. Bakit, class? The purpose of that is check and balance. So that the medical director will determine, no? The medical director will determine, kailangan ba talaga ng surgery? Do I need to authorize this surgery kahit wala pa yung family members para lang ma-save yung life ng pasyente? Or pwede pa naman na hintayin ko yung family members? Okay? You know, things like that could happen. Things like that could happen if sometimes class wala talagang family member na nangyayari. Okay, or nahahanap. Pero ang usual na na-encounter ko sa ER, mga nahimatay sa Smallville, nahimatay sa night out, pagkatapos hahanapin yung parents, pero mamaya pagkagising ng student, parang yung expression, "Sir, bakit hinanap niyo si nanay? Bakit niyo hinanap si mama?" Okay, lagot kay mother kasi nga nahuli Kaya yan, huwag kayong basta-bastang umiinom ng marami, lalo na kung hindi kayo sanay. So simulan nyo na today. Kidding aside, baka simulan nyo rin. Okay? I hope you're getting the point. Do not engage yourselves in these coping strategies. So for those na umiinom, paki-gradually reduce na. Sa mga hindi pa umiinom, huwag nyo na munang i-try. Kasi marami po ang ginagawa na nilang coping mechanism yan. So later on class na it would lead towards poor coping mechanisms. Okay? Marami na akong students na nakitang ganyan sa ER. Okay? So again, that's for the principle of autonomy. So as you can notice, the patient has the right to decide for himself, but there are also circumstances na naiiba siya. Another, how about if the patient is mentally incompetent? Okay? In your terminologies, buang. Di ba? Buang. Let's say, for example, if the patient is buang, mentally incompetent, what do you think? Will the patient be able to practice autonomy or will it be left to the significant others?
Left with to the significant others, sir.
Okay, class. The autonomy is with the significant others. Okay? Autonomy is with the significant others. Hindi na po yan si pasyente kasi nga po, si patient, pagkita nyo sa'yo sa hospital, sabi niya, ay manok, kay masarap lutuin. Okay? Uy, minsan nakakatawang example lang siya, class, but you will see patients like this. Tapos class, I have encountered patients wherein they will go in the hospital and then they are shouting because spiders are actually crawling down on their skin, but actually there's none. No? So these are signs of schizophrenia, mental health problem. Nakakatawang example lang siya paminsan-minsan, pero you know what, when you see patients like this, nakakalungkot na. They're going through a lot and they were not able to cope with the problems that they have. Okay? Now, patients' rights. When I talk about patients' rights, my dear students, your patients' rights is pertaining to your patient, of course, and patient is anyone who has requested to be evaluated by any healthcare profession. So, ibig sabihin, for example, kapitbahay nyo, neighbor, went to you just to have the BP check. That neighbor is already your patient. Okay? For example, somebody came into the hospital for blood test. Hindi naman siya admitted. But as a nurse there, you can treat her already as your patient. In other words, guys, for example, papunta yung patient sa laboratory. Yung laboratory nyo halimbawa, malayo pa kasi very big yung hospital nyo. No? Pagkatapos, the patient accidentally slipped. Okay? Or the patient accidentally tripped. Tapos natumba. If you've witnessed that situation, as a nurse, you are obliged to respond. Huwag mong sabihin na, pasyente naman yan ng laboratory, hayaan mo na yan, lalakad lang rin yan. As a nurse, it is happening in your facility, you need to manage that patient. Sir, ako ba talaga may 6 na pasyente pa ako or 10 pasyente sa taas? Call for help. Call for help. But hindi pa pwede na daanan mo lang siya and then, hayaan mo lang, gigising din yan, hayaan mo lang. Okay? So hindi. They are considered to be your patients. Okay? For example, I as a nurse, for example, somebody will message me. Then, that person will ask, Sir, okay lang ba ang ganitong gamot? By the time class that I start responding to this person, that person could actually also be considered to be my patients. In other words, the patient's rights would apply. And what are these patients' rights? Right to be treated with respect. That's why we say, ma'am, sir. Okay? Kahit ano pang sigawan niya class sa ER, kahit ano pang wild ng patient sa ER, good morning, ma'am, how are you feeling today? Okay? Or sabihin mo, good morning, ma'am, may I check your vital signs? No? Kahit ano pang wild ng patient sa ER, that's how we deal with it as a nurse. No? Respect. Now, right to obtain medical records. Can you photocopy the chart in the hospital? If you have gone to the hospital already, if you went to the hospital, I mean already, so you know that there is a chart, no? And the chart pertains to the entire care that you have as a patient. Okay? As in entire care mo doon sa hospital. Now, question. Pwede ko bang i-photocopy ang buong chart as in the entire chart? Okay, on chat please, can I photocopy the entire chart? Sige na. I'm looking at responses.
If own niya guro, sir, nga chart, pwede, sir.
Di ba? That seems to be a good answer. Huh? That's a good answer. How about others?
Hindi,
Okay.
chart yun, sir.
Hindi. Sino sa inyo naka-experience sa hospital? Sino sa inyo naka-experience sa hospital? Who among you, for example, upon discharge, bago umuwi, requested for the medical records? Were you allowed to photocopy it?
No, sir.
No daw, no? No. Okay? So, but earlier, parang may point si classmate, di ba? The chart is about me. No, halimbawa, I'm the patient. The chart is about me. How come that I could not be allowed to photocopy it? Now, plus when I talk about the right to obtain the medical records, the right to obtain the medical records is limited only to the following documents. Okay? Laboratory results, results of your diagnostic studies, and then maybe plus the record of operation. Okay, so laboratory and diagnostic results, and then the record of operation. Okay, class, when I say chart, maraming components yon. Nandyan ang doctor's order, nandyan ang nurse's notes, nandyan ang vital signs sheet, nandyan yung graph, nandyan yung MIO sheet, the monitoring of the intake and output, and the like. Now, all of those class are actually happening in your patient's chart. Now, you need to take note that the chart is about the patient. Tama yung sabi kanina eh. Sir, about naman sa kanya yan. So the chart plus is about the patient, but the physical property of the chart, is owned by the hospital. Okay? Yes, you are the patient. The things written there is about you, but the paper is mine as the hospital. The still chart is mine as the hospital. Okay? So, halimbawa sabihin ni patient, "Uy, nurse, pa-photocopy naman ang nurse's notes nyo. Parang maganda naman yung handwriting nyo." Hindi pwede. Pero pag sabihin, "Nurse, pa-photocopy ng labs," anong usual nating response? "Sir, will inform the doctor and will also prompt the doctor that you need it." Okay? Pero bakit may doktor pa? Kasi class, by the time that they will see the laboratories, tapos pagkakita, cancer, stage 5. Pag nag-heart attack siya, guys, kayo ang lagot. Ha? So meaning class, the doctor needs to be informed that the patient is taking hold of these laboratories just for us to ensure that the doctor has talked about all of these laboratories to our patient also. Okay? O paano pag makita niya, hala, ang raming abnormal, bakit dito ginamot ni Doc? Ba't dito ginamot ni Doc? Ba't dito ginamot ni Doc? Kasuhan ko kaya si Doc. Okay? So dapat class, alam ng doctor that the patient has the copy of the laboratories so that the doctor will also be oriented on the things that need to be reinforced in educating the patient. So again, the patient can photocopy parts of the chart but not the entire chart. And what are these parts? The results of your laboratories, diagnostic test, and then the operative record. Okay, those are the things that they can access. Then, right to privacy of medical records, which means that, okay, for example, if I have here, for example, Dr. Inocencio, Dr. Defensor, Dr. Torres. I am a patient and then my physician is Dr. Torres. Can Dr. Defensor open my chart? Hindi, no? Dr. Defensor halimbawa is my best friend. As in my long time best friend since college days. Can she open the chart? Mas na hindi pa rin. Okay, mas na hindi. Kasi nga best friend ko siya, di ba? May emotions attached to it. Okay? So take note of that. Only Dr. Torres has the right because Dr. Torres is the one handling me as the patient. Okay? In the same way, if you are the nurse in station 1, you don't have right to access the charts of patients in station 2. Okay? Kahit kami guys, no, for example, when we were having I had administrative roles already. If a family member or if a close friend of mine is admitted, I do not go to the station and then open the charts, no. But you know what? If you would look at it, the nurses would be giving it to us because, of course, we are their bottom. No? But then, if you would practice ethic, you need to understand. You need to understand that there are things that you don't need to know, and even though that patient is your friend, there might be things that that patient is hiding from you. And then, by the time that you will know it through the patient's chart, how will you handle the information? Okay, so it's best for you to not cross the line. When you are taught that you are supposed only to open the charts that are your patients, follow that. Okay, so that you will not be exposed to ethical dilemmas in the future. Okay, you have any questions in mind?